Today, we're going to tackle a problem that, let's be honest, anyone who's ever been to a hospital knows all too well: the chaos. We're going to explore a system from Zion IT that promises to swap all that chaos for something calm, efficient, and truly focused on the patient. Let's see how they pull it off.
So, does this look familiar? Yeah, I bet it does. For so many healthcare professionals, this is the daily reality. Phones are just ringing off the hook. Patients are waiting anxiously, and your staff is desperately trying to connect the dots between all these different departments using systems that, frankly, are totally outdated. It's a perfect recipe for burnout and a really frustrating experience for everyone involved.
And this chaos isn't just a feeling, it's the direct result of some very real, very concrete problems. We're talking about fragmented systems that just don't talk to each other, manual processes that haven't really changed in decades, a total lack of coordination that leaves everybody in the dark. The bottom line? This inefficiency isn't just a headache for the staff, it's a huge barrier to giving patients the best care possible.
But what if there was a way to untangle this whole mess? What if you could actually move from all this complexity and chaos to a place of streamlined, smooth efficiency? Well, that's the transformation we're going to look at right now.
Meet Good Health PMS. At its core, it's a system that brings everything, and I mean everything, together in one place. And it's all accessible from anywhere. It's designed to connect all the moving parts of a hospital or clinic to create one seamless experience for both your team and your patients. Honestly, this is what modern healthcare is supposed to look like.
So, let's dive into the real-world transformation. We're going to go through the biggest operational headaches one by one and see exactly how this system takes you from that manual chaos we were just talking about to a smooth, automated flow.
First up, managing multiple locations. You know the old way, right? Separate records, constant phone calls just to check a doctor's availability, and absolutely no unified view of what's going on. The PMS solution just replaces all of that with one single platform. Now every clinic, every hospital branch, they're all operating from the same synchronized data, so you instantly know which doctor is available, where, and when. Problem solved.
Next, let's talk about your most valuable asset, your doctors. Onboarding them manually and trying to track their schedules is a huge time sink, and it's a major source of errors. With Good Health PMS, that entire process becomes automated. Onboarding is way faster, schedules are always accurate, and you can see a doctor's availability in real time. What does that mean? No more double bookings or frustrating scheduling conflicts.
Payments and consultations. These two things are so often a major disconnect. A patient might have a video call, but then the payment has to be handled through a totally different, clunky system. This PMS integrates it all. Video consultations flow directly into a flexible, transparent payment process. For the patient, it's just one simple, connected experience.
And now, for everyone's favorite topic, the waiting room. Long, uncertain waits are a massive source of patient dissatisfaction. We've all been there. A smart queue system completely changes this game. It gives patients real-time updates on their position, it manages the flow intelligently, and it gets rid of that awful feeling of being lost in the crowd.
So what does this all feel like from the patient's point of view? Just imagine this for a second. You connect with your doctor's office instantly on WhatsApp. You can access your own health records, see your place in the queue right from your phone, and even have your consultation through video call. This isn't science fiction, you know. This is what a fully connected healthcare system actually looks like.
Okay, so all of these features sound great in theory, but what does it actually deliver? Let's look at the proof, the hard numbers that show the real, measurable impact of this kind of transformation.
First up, a 30% faster patient onboarding process. Now, that's not just a number on a screen. That means less time patients spend in the waiting room with a clipboard, it means a better first impression of your hospital, and it means a more efficient start to every single appointment. It really sets a positive tone for the entire experience. Next, a 40% reduction in admin time. Just think about what your staff could do with all that extra time. Instead of chasing paperwork and playing phone tag, they can actually focus on what really matters: supporting doctors and providing compassionate care to patients. That is a huge win for both efficiency and morale.
This one is staggering. 70% of communication is automated through WhatsApp. We're talking about everything from appointment reminders to follow-up messages. This dramatically reduces no-shows and frees up your phone lines and your front desk staff to handle more urgent patient needs.
And finally, a 50% increase in video teleconsultations. This shows that when you remove the friction, when you make telehealth easy,
People will absolutely embrace it. It means you can reach more patients, provide more convenient care, and truly extend your services beyond the four walls of your hospital.
Seeing it all together like this is really powerful. It's not just one little area of improvement. It's faster service, it's way less administrative burden, it's vastly better communication, and it's more modern care delivery. The cumulative effect of all this is a fundamentally more efficient and patient-friendly hospital.
This quote really just says it all, doesn't it? The whole goal here is to take every single core function of your practice, from the moment a patient first makes contact all the way to their final payment, and just make it simpler, faster, and completely connected. That's the whole value proposition right there.
So after looking at the challenges and the clear, measurable results of a unified solution like this, the final question is a pretty simple one, really. Is your hospital ready to move from complexity to clarity? Is it ready for its transformation?